एक स्क्रीनशॉट पहले ही ले सकते हो।
Okay, good afternoon, everyone. I welcome all of you in this program on ISO 15189-2022. The new standard was released on 4th of December 2022, and since then, all of us are a little confused. What are the changes in this new edition? If we are already using ISO 15189-2012, how much there is change? How exactly we are supposed to modify our documents? And people who are India, they are worried when NABL will start accepting applications as per this new edition. For how long this new edition will remain valid? Assessors are worried when accreditation body will conduct some training for us, how we will know about the changes and its implementation and what is expected from the laboratory. Some people are confused whether quality manual is required or not. So I thought we shall have some program, some discussion. What are the changes in this new edition? Now, first, let me check from one of you, Dr. Jayashree Jankar. Dr. Jayashree, please unmute yourself.
Yes, sir.
Jayashree,
Good
am I
afternoon.
clearly audible?
Yes, sir. You're audible.
Okay.
You're audible, sir.
Okay. And can you see this slide?
Yes, sir. It's visible.
Changes and implementation?
Yes, sir. Yes, visible.
Okay, right.
Okay.
See, why these changes were required, we have to understand. Third edition was released in 2012. And since then, in last 10 days, we observed some significant changes. ISO 15189 is based on ISO 9001 and ISO 17025. After the release of this third edition, 9001 was revised in 2015, 17025 was revised in 2017. So people thought because 15189 is based on these two standards, so this 15189 also shall be revised as per this 9001 and 17025 latest edition. And it is a custom, whenever this ISO standard, a new standard is released, they review after 5 years to decide whether some changes are required or not. The meeting on this 2012 was held in 2017. A survey was conducted and they asked for the opinion and they received around 1600 different responses. I'm telling you just some background, how this new standard was developed. Then there was few meetings. Then we had one ILAC meeting in Frankfurt in 2019, end of October. There it was discussed POCT also shall be incorporated, because right now we have standard for POCT 22870, and there is no accreditation on the basis of this 22870, and these POCTs are either used in the medical laboratory or these are supported by the medical laboratory. So they thought this POCT shall be incorporated in 15189. So these were certain things why it was decided to revise this ISO 15189. And there is increased focus on the welfare of patients. And after many Zoom meetings, after many hours spent resolving comments, and there was some committee draft, then draft international standard, final draft international standard. This 15189 was released finally on December 4, 2022. 49 months after the start of project. In between, we faced, in fact, all of us on this globe faced this COVID-19. But meetings were going on through online mode. Previously, there were 5 clauses. Now there are 8 clauses. First, 1, 2, 3, they are the same. Scope, normative references, terms and definitions. Then what you need to implement in your laboratory, you have 5 clauses. Previously, these were management and technical. Now they have divided, they have structured in accordance with 9001 and 17025, general requirement, structure and governance requirement, resource requirement, process requirement, and management requirements. Then there are annexes. In this, they have mentioned few additional requirements of point of care testing, comparison between ISO 9001 and 15189, comparison between ISO 17025 and 15189, and comparison between previous edition of 15189, 2012 and 2022. What I will suggest all of you, when you are reading this 15189 2012, read this as an independent edition, as you are reading this for the first time. Try to understand the requirement of this 2022. Don't start comparing this with the 2012. Otherwise, you will get confused. First, understand this. Okay, it is asking about advisory activities under clause 5.3.3. It is asking about personnel under clause 6.2. First, understand the requirement, develop concepts in your mind, then start comparing with the 2012. Okay, in this standard, it is asked in this particular clause where it was asked, and what are the things which are asked here, but were not asked in the previous standard. What were the things which were asked in the previous standard, but not asked in this standard? But first, develop good understanding of this 2022, because NABL has not yet started application as per this new standard. You have time. And they will keep on accepting application as per old standard till 31st December. So you have time. Develop good understanding of this 15189 2022, and you have ample time. Then start implementing this in your laboratory, whether you are going for the accreditation for the first time or you are revising your documentation from old to this new standard. In this scope, there is no change. Only thing is POCT is added in this standard. In normative references, there is no change. In terms and definitions, certain definitions are added and few are excluded. These are clauses only for your reference. What you need to implement in your laboratory from clause 4 to clause 8. There is, in this standard, there is more emphasis on the risk management, more emphasis on the processes, and more emphasis on the patient requirements. See, you see any laboratory and you will find the same sequence of events in any laboratory. You will not find any change. Every laboratory is following the same flow of activity, and this flow of activity is called process. Process tells you what is to be done, how it is to be done. For every step, you have to develop a procedure, stepwise way to carry out a particular activity. But what is the activity to be confirmed? What is the activity to be done in a laboratory? That flow, whether you are writing in a flow chart or you are writing in a sequence, in a number, that is called process. And wherever further elaboration is required, so you have to develop procedure for that. like this. A good laboratory has documented and well implemented procedure at its step. Sometimes people say we are not going for accreditation, or our laboratory is not accredited, or we are working in government hospital, or we are working in a medical college. So these things are required only if you are working in private laboratory going for accreditation. No, quality is the requirement of each and every laboratory. And 15189 is a document to develop and implement quality in medical laboratory. Accreditation is only a byproduct because you are following and you are going for the accreditation. It is not like that ki quality is required only by accredited lab. A correct report is expected from each and every laboratory, whether you are working in government hospital, government medical college, or some other organization, maybe small district or large metropolitan city. As I said, policies, what to do. And for this policy, you are saying in a flow chart, in a sequence, ki what you are supposed to do and how it will happen. Ki these are the different activities. What is to be done? First, you are deciding in broad terms, then what are the different components and what is the sequence of these components. That is your process. Now, how you will carry out each activity. Suppose you are saying pre-examination, examination, and post-examination. This is a process. For pre-examination, patient is first going to registration counter. From there, sample collection area. From there, sample is received, sample is transported. Then sample is received in the laboratory. From there, sample is sent to examination area. There you are performing examination. This is also flow of activity. This is also a process within a process. First component is pre-examination. For pre-examination, again you have a process. Now, what is the procedure at registration? What is the procedure of sample collection? What is the procedure of sample transport? What is the procedure receiving report? These samples. And again, within some procedure, you may have some process. So like that, you have to understand the difference between process, procedure. Somewhere you will find program also. Documented program for induction of a new person in the laboratory. Documented program for preventive maintenance. Documented program for internal audit. For what is program? Program, unrelated activities when carried out together for a meaningful purpose. That is called program. In this, sequence is not important. You are saying in daily maintenance of the machine, I will check these things. Whether you are carrying out a particular activity first and other activity second, or that other activity first and initial activity second, that hardly matters. You have documented program for orientation or induction of a new person. So in whatever sequence you are carrying out that activity, as long as that activity is there, it is okay. Same is true for your documented program for internal audit. Whether you are going to biochemistry first, or you are going to pathology first, or you are going to inventory management first, it is up to you. But these things shall be part of that activity that is called program. So we have to understand what is the difference between these, and wherever standard is asking for this, we have to develop these. Record is evidence of implementation. So these are normative documents: ISO 77025, ISO 9001, ISO Guide 99. This is also known as Vocabulary International Metrology. Now, some general requirements. This is your clause 4. Standard is talking about impartiality. Standard is talking about confidentiality. Standard is talking about requirements regarding patient. Now, the standard is very particular about the welfare of the patient. So they have added this requirement 4.3, requirements regarding patient. Impartiality was there in the ethical conduct previously also. In confidentiality, in the first sentence they are writing, laboratory has to maintain confidentiality through legally enforceable agreement. What is the meaning? You have to create some legal document, a basic stamp paper sort of thing. You are making an affidavit. The laboratory is committed to maintain confidentiality of patient information. And what is the procedure they are following for that? They are training their people, they are asking their staff to sign some document. They will maintain confidentiality, but it should be through, this is what standard is saying, legally enforceable agreement. So you can make some statement on stamp paper. Legal entity is same. Now in the previous standard, it was defining the contents of the duties of lab directors. Now they're not defining, they are saying lab director shall have delegated authority. Delegated authority means you shall have some documentation. What are the authorities of lab directors? Then in 5.2.2, they are talking about documentation of director responsibilities. 5.3, delegation of duties, documentation of delegation of duty. If suppose lab director is saying, this person will look after internal audit part. This person will see creation of documents. In a medical college, this person will see UG teaching, this person will see PG teaching. This is delegation of the duties. So this shall be documented. And lab director has ultimate responsibility for the overall operation. Laboratory activities, 5.3.1, you have to mention what are the areas you are providing services from. We have 10 collection centers, 3 laboratories, and in this, we have these facilities. So you shall have some documentation related to that. If you have point of care testing, suppose in ICU or CCU, documentation related to that also. Then 5.3.2 saying wherever you are providing services from, you have to maintain the requirement of this international standard. They are guiding you. You follow the requirement of 15189 in your collection centers, in your other laboratories. And certain things shall be part of your advisory activities. This was requirement in the previous standard also. In structure and authority, they are mentioning about organogram, they are mentioning about job description, and in 5.4.2, in quality management, they are saying there may be person or more than one person for this quality management. Previously, there was a requirement of quality manager. Other persons were working or they were reporting to this quality manager. Now they are saying, please don't write on the screen. It is creating unnecessary distraction for all of you. Now they are saying you can have more than one person. One person is looking after development of quality management system. Another person is looking after implementation of quality management system. Third person is in charge of internal audit. Fourth person may be seeing accreditation requirements. And all these 4 persons, they are directly reporting to lab director. Previously, it was not possible. Now, if you want to continue with that previous system, that is acceptable. If you are saying People will report directly to lab director. That is also acceptable. Now standard has made this change. 5.5 objectives and policies. This was requirement of the previous standard also. You have to define quality objectives. You have to define quality indicators. These are mentioned again in clause 8. These objectives and policies in clause 8.2.1 and quality indicators under clause 8.8. No, where it is? 8.8.3.1. They have mentioned the clause number 8. Some of you can check from the standard and mention in the chat box if you have copy ready with you. Right? Then there is risk management. Now standard is emphasizing on this risk management at many places. Quality indicators is 8.8.2. Now they are talking about risk management at many places. In this 5.6 in the beginning, what the standard is saying, you shall have a process. You shall have a process for this risk management. And what is the meaning of this process? See, first you shall have risk management plan. Then you are evaluating your activities. You are carrying out risk analysis. You are identifying a risk activity. Then you are evaluating. You are taking appropriate measure to control that. You are discussing in the management review. These were the areas identified. These were the action taken. And you are monitoring that risk so that it is not happening again. So these are the flow of activities. This is a process. How you will carry out each activity, for that you can develop some procedures. So that way, wherever standard is asking for a process, you have to develop a process. In this resource requirement, what the standard is saying in personnel, they are saying you have to define authorization. You have to define authorization. This person is responsible for routine biochemistry testing. This person is responsible for hormone testing. This person is responsible for the quality management system. This person has to supervise purchase. So that way they are saying authorization. The rest of the requirements are same in personnel. Then in facilities and environmental condition, in 6.3.4, standard is saying, previously it was in the note, you shall have some facility for rest room or where people can have some meeting or can consume their food. Previously it was in the note. Now they have shifted this from note to requirement. Now it is a requirement of the standard. In equipment, requirements are same. Only thing is they have separated calibration and metrological traceability from the equipment. Equipment is 6.4 and metrological traceability and calibration is 6.5. In reagent and consumables, there is no significant changes. Service agreement. In this service agreement, in addition to users, they are saying you shall have agreement with the POCT users. Suppose in your hospital, you have ABG machine or some other point of care testing in ICU or CCU. Who will check about the training of new joining? A new resident is joining and the person has to use ABG machine. Who will train? That machine is supported by the laboratory. And who will carry out daily maintenance? Who will carry out weekly maintenance? How you will take care of quality control on that machine? So for that, you shall have laboratory, and that POCT users shall have some agreement ki how that machine will be maintained. So most of the requirement in personnel, these are same as previous standard. And as I said, they are talking about authorization, to evidence of authorization to perform specific activities. Previously, there was one requirement, performance review. Now they are no longer asking for this because there was a lot of confusion about competence assessment and performance review. What is the reference? How these shall be carried out separately? So now they are saying you take care of this competence part, whether a person is able to carry out or able to give you required performance or not, and focus on continual improvement. So this will be taken care of, this performance review. This I already explained you. And what you have to see, this 15189 is telling you. What the 15189 is telling you? What is to be done? How it is to be done? For this, you need some other references. What are these references? Like 15190, 20658. 15190 is for safety requirement in medical laboratory. 20658 is for pre-examination activity. 20914, that is measurement uncertainty. 19011, that is related to internal audit and auditing technique. Then 22367. 22367 is related to your risk management. Then there is 33,000 and 135,001. These are also documents related to risk management. There is one CLSI document also related to risk management. There are two CLSI documents related to pre-examination activities. These are supportive documents. These are providing these requirements in detail. Likewise, you have many other additional CLSI documents, one document related to training and competence, one document related to validation verification. This is a complete subject, this quality. It is not something like that. The person is saying, I have attended this 4-day training program and now I know everything related to quality. No, it is not like that. It is just a misconception, as a pathologist saying, I have attended a 2-day workshop on immunohistochemistry. Now I know everything related to immunohistochemistry. Many of you are pathologists and performing immunohistochemistry. Write in the chat box, is it possible? Can you say with confidence, or will you accept if somebody is saying, now I know everything related to immunohistochemistry because I have attended a 2-day workshop on immunohistochemistry in a conference. So will you accept such statement? Please write in the chat box. I think all of you will agree with me. No. All of you writing no. Same is true for the quality. Just by attending one program or one lecture, you cannot say, now I know everything. You have to read and read. Only then you will be able to develop your concepts. Today we are discussing in general terms what are the changes. Then next month we will discuss in detail risk management as per document 22367 and CLSI document based on risk management. Then we will discuss in June measurement uncertainty as per document 20914, which is document for measurement uncertainty. And then we will discuss something about documentation, what the different documentation required in 15189 as per CLSI document. So that way we will discuss many things. So we will be able to develop good understanding. I will read because I have to teach. You will read because you have to implement. In equipment, requirements are more or less same. Only thing is now they have separated calibration metrological traceability from the equipment. Otherwise, records are more or less same. In reagent and consumable, there is no significant change. And when you're reading the standard, you have to see wherever standard is asking for specify, or they are asking document or documented. So you have to write somewhere. At some places, they are saying you have to develop a process. At some place, they are saying you have to develop a record. At some place, they are saying you have to develop a procedure. At some places, they are saying you have to develop a program. But at many places, standard is saying specify a document. So these are not covered under process, under procedure, under program or record. But you have to note down somewhere. So whatever management system document you are developing, you can note down in that. So you have all those things documented. As I said, in service agreement with POCT users, 6.8 external provided production services. Previously, they were talking about in 4.5 referral laboratory and 4.6 external services. In external services, we were including vendors of reagents on, or maybe equipment. Now they are saying they have combined this referral lab requirement and external production services. Now they are saying you evaluate, in addition to these, vendors of your calibration lab, vendors of your EQUAS provider. Now, that is also a requirement. You have to select and evaluate these also. Here, we are talking about process, pre-examination process, examination process, post-examination process, non-conforming work, control of data and information management, complaint, continuity and emergency preparedness. Many things were requirement in the previous standard also, but there are few changes. Now the standard is emphasizing more on the processes. What is the flow of activity? How the laboratory is working? See, in any industry or in our laboratory also, you can see there are two things. You are following a process and you are developing a product. What is the product? A report. What are the ingredients? Or what product is output? What is the input? A sample. A quality of product is only as good as the quality of sample received. So our input also shall be good. And in between, process also should be correct. So we have to concentrate more on this process. And thing is, we have to enjoy these process. When we will be able to enjoy? When we are able to carry out these in a meaningful way, in an error-free way. So for this, we have to develop a good process. Wherever a procedure is required, we are developing that. so that we are able to carry out all these activities properly. In pre-examination, as I said, it influenced the outcome intended examination. In laboratory information to users, there is no change. It is same. Oral request. Previously, they were using the term verbal request. Now they are saying oral request. POCT agreement should be done between laboratory and POCT users who are in charge of the place where a POCT is being performed. These are also same. Before collection, certain information you are checking. If suppose it is prothrombin time, whether the patient is on oral anticoagulant or not, or if there is any recent change in the drug. And when a patient, you are providing some instructions, and after that, when a patient is coming to you, you are collecting sample, you are verifying whether the patient has followed all those requirements or not. In sample transportation, previously also it was implied requirement. Now they have added, maybe after this COVID-19, packaging of sample for transportation. Otherwise, time, temperature, and you have to see integrity of the sample and safety of the person who is carrying those samples. So packaging of the sample is very important. And these days you are finding a lot of collection centers, a lot of additional laboratories. Samples are being transported from one place to another. There is so much transportation, and people who have experience of more than 25 years or more than 30 years in the laboratory, if any one person is attending, you can write in the chat box, what is the change you have observed in these 30 years? Transportation of the sample has increased significantly. Gone are the days when patient used to come to laboratory in the morning, they are providing samples. In the evening, they used to come to collect the report. Now, collection boys is going, they are collecting samples. In the evening, reports are transferred through email. I am not against technology. What I am saying, whatever we are doing, we have to see it is not compromising quality. If we are collecting, so we have to put a lot of emphasis on the correct transportation of the sample. Our people should be guided about that. It is not like that we have very good laboratory. We are collecting sample properly, but because of this poor transportation, we are not able to generate a quality report. Sample shall be protected. After receiving in the lab, there is some delay in the test to be performed. If you are asking for additional tests, for how long you can ask for the additional test, that laboratory has to document, and the laboratory has to ensure sample stability also. I always find a lot of uncertainty regarding understanding of this measurement uncertainty. It was requirement in the previous standard also, it is requirement now also. And if you are using this measurement uncertainty, if you are measuring something as an intermediate step in a qualitative test, you have to see for the variation in that measurement, you are considering measurement uncertainty. This we will discuss in detail when we will discuss measurement uncertainty. You shall have reference for this biological reference interval. Hardly any lab is developing their own biological reference interval. Whatever biological reference interval you are using, you see whether that is appropriate for your reference population or not. So for that, what you can do, suppose you are saying biological reference interval given in the Harrison for plasma glucose is 70 to 110. Take samples of 30 healthy male patient, 30 healthy female patient, or if there is no gender difference, 30 patients, and check the biological reference interval or check the glucose level in this and mean plus minus 2 standard deviation. See whether it is coming between that defined range or not. If it is coming within that you have checked your biological reference interval. Because if you're developing, then it is a big procedure. But you are only verifying your biological reference interval, then you can do that with 30 samples. It is given in CLSI document. Now, previously standard were describing certain points for this examination procedure. Now they are saying you develop procedure as per the requirement of your laboratory. Whatever procedure you are selecting, whatever information you are thinking, it is important to be documented in this procedure. You document that. Previously, it was separate clause. Now they have included in the examination part only IQC, QAS, comparability of examination result. Previously, also these were the requirement. But now what they have done, IQC is same. In EQUAS, what they are saying, you select 17043 accredited EQUAS program and ask from the EQUAS provider how they have decided about the target value or group mean. The term which standard is using, that is assigned value. That is assigned value. How they have developed this assigned value, that is group mean, or it is decided by a panel of experts, or it is decided based on some reference material. Whatever way they are deciding, laboratory should know this. Post-examination, it is same. In 7.4.1, they have combined clause, previous clause 5.8 and 5.9 and part of 5.7.1. I think they have combined 5.7, 5.8 and 5.9. In this critical result, otherwise it is same. They are saying laboratory shall have escalation procedure for laboratory personnel when a responsible person cannot be contracted. Previously, it was not required, but now they are saying if suppose you're calling nurse, she is not picking up the phone in the ward. You are calling directly to resident doctor. If he is not picking up the phone, senior resident, then maybe junior faculty, senior faculty, you shall have a escalation procedure because it is a critical result. It requires immediate therapeutic intervention. So you shall have some system for this. Now they have removed the term preventive action because it was creating some confusion. So now they are saying whenever there is any potential non-conformity or non-conformity, take action, and that will be considered as action to correct that. So now there is no preventive action, only corrective action. But maintain good record of all these things. Previously, feedback was also included in the complaint. Now they have kept feedback separate under clause 5.6.2. In the complaint, they are saying you shall have a process. You shall have documentation of receiving complaint. You shall have some system how you're resolving complaint. So all these things you are documenting and maintain record of complaint, and complaint handling system shall be available on public display, maybe on your website or maybe on your lab. A description of the process for handling complaint shall be publicly available. See, here the standard is saying laboratory shall have a process. In the risk management also, laboratory standard was saying laboratory shall have a process. There also, I showed you one process. Here also, it is a process. You are receiving complaint, you are substantiating complaint, investigating, deciding action, then you are monitoring your action that way. This emergency preparedness planning also, I think people realized after this COVID-19 situation, the laboratory shall have some system. How you are planning for emergency preparedness. So this should be periodically tested, whether it is effective or not, because you may find something at global level, maybe something at country level, maybe something at your institution level. You are in medical college, there will be some outbreak of food poisoning or something else. Some immediate laboratory support is required. That way you have to develop some system. See, this is your process for emergency preparedness. What I am, this is as per CLSA document. So that way you have to develop wherever standard is asking for a process, some process, wherever standard is asking for procedure. So that way we have to think about it, we have to read, and we have to develop some documents related to this. Then your in 8.1 and 8.2 standard is only guiding us. People should be aware of management system documentation. At all places you develop documents such a way these are effective. Then control of document, previously it was 4.3 document control. What they are saying, it is the same, requirements are same as the previous standard. And you have to realize one thing, this document control of document is applicable not only to internally generated, externally procured documents also. You are buying so many textbooks, you are using for reporting, for other references, here some journals, those also shall be controlled. In this standard, they have not defined internal audit and management review meeting interval. So what you can do, whatever you were doing previously, once in 12 months, you can continue with that because they have not defined anything to continue with that. We developed process for the risk management under clause 8.5. Risk and opportunity. Here you are identifying risk and acting on the risk. There you develop process, and here you are implementing this process in the identification and action on that risk management. See, these are the potential risk areas for your lab. Management, competence of staff, patient identification, specimen integrity, specimen traceability, specimen analysis, that is the examination part, verification, validation, quality assurance, reporting of result, turnaround time, proper communication. All these things are potential risk areas, and maximum non-conformance we get in the acceptable QC performance. For enrollment and participation in EQUAS program, you can say something related to EQUAS or IQC, staff training and competence issue, then maintenance of the equipment, validation, verification procedure. In this new standard, when you will read this carefully, when you will start implementing, you will find laboratories have more flexibility to decide how they are fulfilling the requirement, but it is a challenge for assessors. They also have to see in a broad-minded approach, they have to see from laboratory perspective, whether it is serving the purpose of laboratory or not. There is strong emphasis on risk management and continual improvement. As I said, it is more challenging for accreditation assessors. And it is not something like that. Previously, what was happening when assessor is coming, Are you doing something for risk management? It is a requirement of clause 4.14.6. Yes, sir, we have this format and we are filling this. Okay, it is okay. No, no, no. You have to see at each and every step, pre-examination, examination, post-examination, what are the areas where a error can occur, or if there is some potential deficiency, or we are working in a way something may happen. We have to improve in this area. So that way we have to assess risk at each and every step. See, what is the purpose of laboratory? Laboratory is existing to deliver information. That information will be used in the diagnosis and treatment of patients. So now, when we are following this new standard, we have to develop processes, we have to develop procedures, we have to update these so that we are maintaining these in a required manner. We have to maintain these records. We shall have good document control program. Only current versions shall be used. That shall be available at the workstation. And it should be available to relevant people. It is also the requirement of standard. People should know, and this shall be accessible to people laboratory in the working in the laboratory. See, what is our product? Our product is information. We are providing information. And to provide good information, our processes should be strong, and to develop the strong processes, documents are essential for assuring accuracy and consistency in the laboratory working. Always remember, quality is a journey without any destination. Never think it is burden on you. Actually speaking, it will reduce your burden. And it is possible to maintain with the cooperation of everyone working in the laboratory. Thank you for your kind attention. Good luck to all of you in all your future endeavors. Start implementing this ISO 1509-2022 whenever you are asked to implement this, and develop a good understanding of this ISO 15189. All of you, please switch on your video. We will have a group photograph. Oh, I can see many familiar faces. Diya Bajaj, are you from Jabalpur? Netaji Subhash Medical College. Yes, please unmute yourself.
Hello. Yes, sir. Good
Yes, you're
afternoon.
audible.
Yes, sir.
Hmm.
This is from my lab, sir.
Okay, this is from your lab. Arey wow, you have very big lab. Good. So whenever
Yes,
I
sir.
will come to Jabalpur, I will visit your laboratory.
Sure, sure.
Great.
Most welcome, sir.
Oh. You can see many familiar faces here. Now, 1, 2, and 3. Yes. Then next photo. 1, 2, 3. 1, 2, 2. Okay, Ann Wilson, please unmute yourself. No, same and Wilson. You are in KIMS. Right. Okay. All of you, please fill the registration form and also the feedback form and suggest some topics to arrange few more lectures, and you will get certificate in 2-3 days. Only thing is you have to fill your registration form, right? Yes, Surinder Gupta ji. Good afternoon. I'm not here able to hear you. Okay, so now we are ending this meeting here. Looking forward to meet you again in the next lecture, maybe sometimes face to face also. Thank you.